And this is all happening as the Senate is quite literally returning to Capitol Hill as we speak. They were supposed to be on recess, but they canceled that recess to deal not just with the economic stimulus package, but also to reauthorize some expiring surveillance um, authorities under the FISA. Um, the House did pass an economic stimulus package on early Saturday morning. It has hit a snag though, and this is what we're following. Again, sort of as we speak, this stuff is happening right now. We're going to go through some of the major things we've learned about the stimulus package, about what's happening with it, and about what's going on at Capitol Hill. We will take questions at the end of this webinar. You can start queuing up in that by submitting your questions to the Q&A box or the chat box. Those are located towards the down part of your screen. There's a sort of a list of icons. The thought bubble there thing is the chat box, and then if you go into more options, there's a Q&A box. So we will take those questions later on in the webinar. But right now, I want to start with David Lerman and ask about David. What do we know about where the economic stimulus package is? Because the House was considering trying to pass a technical correction, set of technical corrections to the package, but we don't know where that is exactly right now, do we?
Right. I mean, it looks like this bill is in something of a mess, frankly. They're promising a technical correction that could be a lengthy ordeal and maybe much more than technical. That's how it was advertised, but we don't really know. It sounds like it's more substantive, frankly, now. I mean, look, even with a pandemic, Congress is up for a partisan funding fight. I mean, this bill has been tossed around for days and days. They finally tried to ram it through Friday. It took till the wee hours of Saturday morning, and neither side was particularly happy, I think, with the end product, and there's still a lot of screaming about it. And the biggest point of contention is clearly this issue of paid leave. This bill was giving a lot of workers anyway, we don't really know how many, 2 weeks of sick leave paid and up to 3 months of paid family medical leave. And there was a big concern of, can businesses really afford that burden at this time with the economy already degrading? So they've offered, Republicans pushed to offer these employer tax credits to help offset the cost. Well, business groups were not satisfied that that's going to do the trick, and they're still massaging that language now, and I think we're going to see them come back with amendments to improve that provision in some form as they see it. And you know, the small business groups were complaining because this would require small businesses to provide paid leave, and they exempted large companies of more than 500 workers, and so they were asking, well, if anything, small business should be exempted, not the large companies that have more resources. And I was told that the reason they did that was most large companies already provide paid leave, although not all, and they didn't want to be offering a new tax credit to employers for something they're already providing. So there was a reticence there to make it apply to large companies, but that may be changing as we speak, Jason, because it seems like as these amendments come in, we may see something on that front, although it's not clear.
Right, and David, one of the things that you know is sort of coming across the wire, as if you will, right now, is that some of the senators who are now coming back into town are saying that they think that they should pass their own package that emphasizes tax credits and some direct payments and so forth. So I mean, we may, even if we get, you know, like some resolution on the House side, just with the technical corrections, we may be running into sort of a longer debate in the Senate.
Right. I mean, even over the weekend, Republican senators were already slamming this thing and saying it needs more work, and they're not comfortable with the burdens on business on this. And so whether they're amenable, but you know, this technical correction we have to see, because they're calling it technical, but it may change the paid leaves in ways that satisfy more people, but we don't know yet. If it doesn't, then then senators may have their own thoughts, and we could well see amendments on the Senate floor, and then it would have to go back to the House for approval again. So this may take longer than they were hoping, as the House was scrambling to get out of town last week, thinking that the job was done.
Mary Ellen, let's talk a little bit about just some of the new restrictions we've seen just recently, sort of outside the Capitol building. We'll get to some of the stuff that we're seeing inside the Capitol when we talk to Catherine in a few minutes. But Mary Ellen, why don't you talk about some of the restrictions that the CDC has issued and that states are starting to look at too, as this thing has started to take on a life of its own.
Yeah, Jason. So the CDC came out last night and they recommended that over the next 8 weeks, any gatherings of more than 50 people be canceled or postponed. So that's looking at a lot of things like concerts, sporting events, weddings, parades or festivals. Of course, many of those events had already that are put on by private organizations had already been canceled after, many of the sports leagues in the country postponed or suspended their seasons last week. But that's really, guidance for, I personally know a handful of people who were contemplating whether they or close friends or family members should be canceling weddings in the next couple of weeks. So that guidance came out from CDC last night. That did not apply to businesses, schools, and colleges and universities, the CDC said, but on a statewide level and a city level, you've seen a lot of officials in the last 24 plus hours banning or prohibiting restaurants and bars from being open, a lot of gym closures, a lot of restaurants and bars, they say, are still allowed to do food takeout and delivery to try to, help those businesses stay, open and somewhat lucrative in the next coming weeks. But you are really seeing a lot of local officials trying to, really encourage people to stay home. And that comes after, I think on Saturday, you saw reports, and I certainly saw in DC, a lot of people who were still going out to bars and restaurants and not really social distancing as public health officials had encouraged people to do.
It seems like the last couple of, last day or so, there's been an increased emphasis and now, I mean, when Paris closes its restaurants, I mean, I think that got everybody's attention. It's hard to imagine Paris without cafes and late at night, and certainly in places like New York, San Francisco, Washington are all very social places. But we're quickly reaching the sort of ghost town aspect of this with bars and restaurants.
Yeah, I mean, if you want people to stay home, if you're limiting the places that they can go, that's probably a good incentive for getting people to stay home.
Catherine, let's talk about the Capitol a little bit right now. Certainly, 50 or more would apply to almost any gathering of members of Congress. The Senate is coming back right now. We've seen a couple of folks who have tweeted, or sent along messages, releases, and so forth about their commute. John Cornyn, Texas Republican, said that on his flight from Texas, there were approximately 35 people on his plane. Usually it's about 135. He said. Sherrod Brown, Democrat from Ohio, he was driving from Cleveland today to the Capitol, just for, saying forget it with the airport. But is there a concern because Congress is a place of habits are hard to break. People like to gather. They need to talk in the Senate. Are we going to see even further clamping down on some of the interactions with members and staff and even the press?
Absolutely. The culture of Capitol Hill is changing pretty rapidly in the face of this health crisis. It's now been a few weeks since people were told to stop shaking hands, which is just a natural habit for politicians and aspiring politicians, as many staffers are, to not be able to greet constituents even coming to your office. I asked some lawmakers, when constituents want to thank you for the work that you've done, they want to give you a hug or they want to shake your hand. How are you handling that? And at first it was the elbow bump that we've seen and that we saw last night at the debate between Joe Biden and Bernie Sanders. But now the recommendation is eliminate contact. So give a wave. I know that Senator Angus King, independent from Maine, he posted on Instagram over the weekend he'll be doing the Star Trek "Live Long and Prosper" sign. It's important to note that there are now cases, positive cases on Capitol Hill, not yet reported among lawmakers, but staff in both chambers have tested positive. That has resulted in widespread working from home, working remotely. There is a growing number of members who are self-quarantining. Ted Cruz, who thought that he would emerge from self-quarantine at the end of last week, got word that he had actually interacted with a second person who had tested positive, so he resumed self-quarantine. And I think we are going to see that expand in the coming days and weeks because of the sheer number of people that these lawmakers have interacted with since this health crisis began. I would say to people on the line, I know there's probably people from interest groups, advocacy organizations, lobbyists. A lot of those meetings that would have been in person during this busy fly-in and busy on the Hill season are turning into phone calls and video conferences. Many people may have already experienced that. I think lawmakers are definitely stressed about people feeling less valued than, coming and sitting down with your lawmaker is different than getting on the phone with them. But they are really trying to stress that this is not about their interest or lack of interest in your issue or lack of interest in your advocacy. It's a safety precaution. And I think something else that's important to note is that when the CDC and other health officials are talking about vulnerable populations, they're talking about many of these members of Congress. I don't want to single out members of Congress, but there are a variety who have had very serious health issues. Senator Sanders had a heart attack this year. Rand Paul had lung surgery in recent years. There's senators fighting cancer, undergoing radiation that really depletes your immune system. And so they themselves are at very, very high risk and are certainly in the age groups that are at high risk. So that is another thing that is being taken into consideration as they move meetings online. I will say staff are definitely leading the way on those efforts because, as we know, there are still senators with their flip phones, so they are not going to be leading the charge on getting the office on Zoom or anything like that. But their staff are leading the way, and the facilities and technology necessary to make that a possibility is full steam ahead on Capitol Hill with laptops being issued and things like that.
I just want to follow up a little bit right here, Catherine, with what you were saying about some of the members of Congress being in vulnerable populations. We're actually about to publish a story on roll call right now, and we'll move over to CQ as well, that Congressman Mark DeSaulnier, a Democrat from California, from Bay Area, he fell during a run. I mean, he was running and he fell, and they think that he fractured his ribs, and so they were worried about pneumonia. He's actually in the hospital right now. And again, this is the sort of thing that you see where that's an imminently treatable thing, but if you're worried also about this other stuff, I mean, it puts you into another vulnerable category. So I don't want to belabor it too much, but Congress is a microcosm of our society, and sometimes we don't see some of these things coming. So one thing I do want to sort of note too is that we've already seen. I mean, this was supposed to be a recess week. The House did go out on early Saturday morning after passing its initial economic stimulus bill, but the Senate, is canceled its recess and is bringing people back in. One of the things that we've already seen a cancellation from a scheduled hearing that Senator Alexander, the chairman of the Health, Education, Labor, and Pensions Committee, was scheduling for later on this week about the virus, and he canceled it out of you'll hear this a lot, out of an abundance of caution. So one of the folks on the webinars asked, like, are we going to start seeing, I mean, have they canceled authorization and appropriations hearings? right now, we haven't seen a slew of these cancellations, but I think it is only a matter of time as the reality starts to hit. So I would be flexible if you have a hearing that you're paying particular mind to for when they're scheduled to return on the 23rd of March. I would stay flexible because I don't think that we're going to see uh, a, a lack of cancellations on these things. We haven't seen any wide scale cancellation yet, but I would guess that we will see a few. I wanted to
Jason,
turn
can I
it.
jump in
Yes,
quickly?
please, Catherine. Yeah.
For people who are looking out for specific hearings, it's really important to note that there were limitations put down last week about who can access House and Senate office buildings during this health crisis. And while visitors with official business, so you have a meeting on the books with a lawmaker or with a staffer, those are still going forward. You will need to be escorted, but those are still possible. If you would have been a person who was, for example, standing in the line for the public to enter a hearing, uh, that is not an official meeting for you to be in attendance. And so you may not be permitted into that office building where that hearing was taking place. So that's just a thing to note for anyone who likes to be in the room where it's happening. I can't speak to whether they will continue on, with the live streams without the public being in the room, but I just wanted to make sure note that people will have trouble, members of the public will have trouble getting into these buildings to watch any hearings that do go forward.
Right. I did want to throw to David Lerman right now because David, I mean, it seems like, most of the time you are consumed with a lot of appropriations hearings, especially right now. This is a very busy time. Even though the chambers aren't going to be looking at passing any kind of budget resolution, this would be normally when they come back from the spring break, really high time for appropriations hearings. What are you hearing from some of your sources? Are we in wait and see mode?
Well, I think so, Jason. I mean, look, we just had several weeks, we should say, of tons of hearings, so a lot of it's already getting going. And this week, of course, there really weren't any hearings scheduled anyway because the House is in recess. The Senate's here, but just to do this major bill, really, they hadn't planned to be here, so there weren't hearings going to happen this week anyway. As for starting next week, obviously it's going to be wait and see because we just don't know. We don't know if they're going to extend their recess, and if they come back, we don't know if they're going to have hearings because that's going to conflict with the social distancing so-called rules that they don't want a lot of people jammed into a hearing room. So I think we're just going to have to wait for guidance on that as to whether we're going to see hearings or whether they're going to get postponed.
Question comes in also about whether the Senate's, like more inclined to mandate paid sick leave and family leave and provide tax credits to large companies in addition to smaller ones. I mean, those are pretty key components of the House bill, right? So we're waiting to see how they react to that. Is that true?
Well, that's what I was trying to discuss earlier because that's a big sticking point in this bill right now. And what I was suggesting is I think there's a movement afoot now to actually extend this mandate into large companies, not just small companies. The initial House bill said it only applies to companies with fewer than 500 workers, but that might be changing as we speak, and there may be a move to broaden it to almost all companies except for the very small, under 50 workers, because there's an argument if small mid-sized companies have to do this, why wouldn't large companies have to do it too? And so you might see that changing. As I was saying, that the explanation I had gotten last weekend for exempting the large companies is that most large companies already provide some paid leave, and so they didn't want to have to offer a new tax credit that's very costly to get companies to do something they're already doing. But that argument might be going by the wayside because you might want a broader if you're going to do paid leave, they might want a broader mandate that says all companies or almost all companies have to provide it. So that's one of the big things we're waiting on to see if that gets sorts out today.
And Mary Ellen, there was a little bit of confusion last week when different officials were talking about what would be paid for by health insurance companies, about testing and treatment and so forth. Where are we? Where are we now for people who? Let's just start with private insurers. Like where are we right now with costs and who's bearing copays for coronavirus testing and treatment?
Yes, so a lot of private insurance companies have come out and said that they will voluntarily waive any copays or deductible responsibilities that patients who are tested for the coronavirus may encounter. So that would be like if you go to your doctor's office, the visit as well as any copay that you might face for the test would be waived. A lot of private health insurers have said this. That said, for the majority of private health insurers, that does not extend to treatment that you may need if you are diagnosed with the coronavirus. So it's really just the tests that private insurers have come out and said that they will be waiving those out-of-pocket costs for people on. Several of the federal government's healthcare programs, Medicare and Medicaid, have said that they will also, be helping people and waiving cost sharing for the test. And then in a hearing last week before the House Oversight Committee, there was a back and forth between the CDC director, Robert Redfield, and Congresswoman Katie Porter, a Democrat of California. And Congresswoman Porter was pushing Dr. Redfield to agree to waive cost sharing and cost responsibilities for people who are uninsured who got the test. And, I saw it going around Twitter a lot that during the hearing, the director of the CDC said, yes, we are going to commit to this, but after the hearing wrapped up, before the chairwoman gavelled out, he did kind of appear to walk that back and say, we're working with HHS to make sure that we have the legal authority and figure out how we operationalize getting testing to be free for the uninsured in this country. So there's a lot of efforts to make sure that people can get the tests. And that's a big concern. That's something that experts were concerned about because, in a regular non-pandemic world, cost and can really be a barrier to people seeking medical care when they need it. That's something that several studies have shown for all types of medical care. So that was a real big concern, with that people wouldn't get the test because they were nervous about the affiliated costs that they might face, which obviously is not helpful as we're trying to kind of track the outbreak of this virus.
And one of the things on another type of insurance, on unemployment insurance, where is the House measure as we understand it? How does it treat, or does it have any effect on the way a person who has lost their job recently would collect unemployment insurance?
Yeah, there's something like $1 billion in there, Jason, to extend unemployment insurance, money that would go to the states to offer, extended weeks of insurance payments. So pretty big bucks there. We should also say, there's a lot in this bill. It's unemployment insurance, it's the free testing, it's $1 billion in expanded food aid, through the Women, Infants, and Children program and food banks. There's increased federal spending on Medicaid. That's important because Medicaid budgets are going to be tapped, are going to be stretched at the state level to accommodate all these people also as illnesses spread. I think there's something like a 6% increase in how much the federal government will give the states for Medicaid. And we should say too that nobody knows what this thing costs yet. I mean, there hasn't been time to do a cost analysis, so the Congressional Budget Office has not come up with any cost estimate yet. They're going to need more time for that. So the House voted on the thing without knowing how much it's going to cost, but the argument from lawmakers was, well, look, this is an emergency. We can't worry so much about the niceties of cost analyses. We have to get this aid going, and we'll worry about the cost later. So that's still where they are. They're going to plow through this thing as best they can without really knowing how much it's going to cost. It's going to cost at least tens of billions of dollars. Some suggestion it might be hundreds of billions of dollars. I mean, this is big bucks we're talking about being rammed through now, but because we do have an emergency.
I actually want to probe a little bit on the state and local level too. I mean, obviously, there's almost no government, no industry that isn't affected somehow by this. um, there, by the time that they had passed, the House had passed this stimulus. This was the second such package that we've seen in the last month. Lawmakers were already starting to talk about a third package. The Senate Majority Leader Mitch McConnell was saying that it's going to be, a bigger one, and that committees are going to have their chance to weigh in, and it's going to be thrown together. Where is the state and local aspect there? Is there talk of helping out state and local governments who, as you said, I mean, just on Medicaid alone, they're going to be stretched pretty thin?
Right, and that's in this bill, but there could be more coming. Look, in terms of what's in the next stimulus bill, that's anyone's guess. I mean, they're talking about everything. I think the more people realize how extensive this crisis may be, the more you're going to see them come up with proposals. They still haven't addressed President Trump's plan for a payroll tax holiday. That would be huge bucks, hundreds of billions of dollars. There's talk of bailing out the airlines, or at least helping the airlines. Trump has talked about that. The airlines just issued some kind of statement this morning, I think, saying they could use $60 billion because they might run out of cash at the end of this year. Cruise lines are also hurt, but there's some pushback from lawmakers to aiding them on the grounds they're not really American companies. But then there's everything under the sun. I mean, we could see other kind of tax credits to help people, refundable tax credits. So if you're not rich enough, you could still get cash payments. We don't know what's going to be in that. The talks are just beginning, but they're going to be heating up, it sounds like, awfully quickly, because the Senate Majority Leader Mitch McConnell said he was talking to all the key committee heads over the weekend on this. Even though the current bill isn't even passed yet, they're already looking at the next one.
And Catherine Telly McManus, one of the things that I find, kind of truly uncharted, territory is that one of the senators who mentioned that he thinks that the Senate should come up with their own package, and he had some concerns about the House bill and so forth, is Senator Rick Scott. He's a Republican from Florida. He's a former governor of the state. He's a former healthcare executive. And one of the things that limits his ability to argue his case is that he himself is in self quarantine. You mentioned Ted Cruz before. Lindsey Graham was in self quarantine and got a negative test result back on COVID. But is this going to really? I mean, this isn't even getting into the House if they return in a little over a week. Is this going to affect like the ability for lawmakers to debate things?
It very well could. Something that I know a lot of people are keeping an eye on is when members can't make it to the floor, that changes the threshold for how many votes you need to pass legislation. I know that Ted Cruz has been really proactive. He's been, on TV and definitely sending letters and things throughout his self quarantine about his ideas for how to deal with this
He's even
crisis.
podcasted about it.
He's podcasted. I do think
What's next,
that
a webinar?
I know it's unclear like how it will affect legislating thus far, because the margins that the most recent legislative action in the House were passed by were so enormous that there was not concern that House members who are self-quarantined were not able to make that vote. Of course, the margins to get anything done in the Senate are much, much tighter. So if we see an expansion of self-quarantine in the Senate, that's something that will certainly come into play. Another element is when they do return from recess, committee action and things like that would be impacted. I think that there is a lot that they are trying to do remotely. And if you do think about it, these are people who are very used to doing their job either on the road or not face to face with each other. They're out campaigning, but also making calls and texting, et cetera, with their fellow lawmakers so that they can hit the ground running when they come back at the beginning of the next week. They're no stranger to making deals over the phone and things like that, but it is the legislating, the act of voting that to this point, there is not capability in either chamber to move that to a remote system. There have been calls for that. I know that Senator Dick Durbin of Illinois urged the Senate to do this coronavirus package by unanimous consent, which does not require all the senators to be in the room. And then senators could submit their position to the congressional record so that their constituents could see which way they voted or would have voted. But at this point, that does not seem like the plan. So we will see what comes next in terms of impact on legislative action.
Returning a little bit to the House bill, again, as we understand it, we're starting to get some more reports about the technical corrections, which could potentially be rather lengthy. But just as we understand it, we're seeing a spate of school districts closing, and obviously, like with distance learning, there's a lot that the teachers can do to help students and so forth. But there are also a lot of people who work in school districts who are not teachers, who might or even contract workers. Is there talk about paid leave and so forth? Does that apply to the school districts, or are those folks kind of on their own, being at the local level primarily?
Jason, I'm not positive on that one. I think we were talking about private companies here, not government, but I'd have to double check on that. And by the way, the latest news seems to be that Chuck Schumer, the Senate Minority Leader, is now calling for a massive new package of at least $750 billion, according to a new release that just came out of his office. Everything from addressing hospital capacity to more unemployment insurance and Medicaid, COVID-19 treatment, loan forgiveness, more help to small businesses, emergency child care, helping with schools with remote learning, ensuring senior citizen medicine, public transportation assistance. He is putting now together, it sounds like, a massive package that's going to top everything we've even seen before. Not clear to me this has any bipartisan support. This may be, it sounds like something just Senate Democrats are working on right now. Very preliminary, we should say, but that gives you some idea of the scope of this thing. This thing keeps mushrooming. If you remember, Trump first called for an emergency package, was it last week or 2 weeks ago, of just $2.5 billion, and only half of that was actually new money. And then what we ended up with when they passed that first supplemental spending bill was $8.3 billion, and everyone thought, wow, they've really upped the ante. Now the bill they're trying to pass this week could be tens of billions or hundreds of billions of dollars, and now even that's considered just an interim step, and they're working on a third package, and Schumer's now saying this one is at least $750 billion. So we're quickly talking big money here.
And I know too that when that first stimulus package you mentioned, that was a little upwards of $8 billion, was
Right.
announced, when the president announced it, Schumer was among the people saying it should be closer to 8.5 billion, and he got pretty close.
He got pretty close to what he was looking for initially, but that all seems just sort of quaint now. I mean, that was some money to just help mostly the Department of Health and Human Services develop vaccines and some treatment, that kind of thing. But still fairly limited compared to what we're talking about now with these new measures.
And one of the things that I'm never ceases to amaze me just how quickly a crisis can bring together some truly strange bedfellows. Andrew Yang, the former Democratic presidential candidate and tech entrepreneur, he staked his presidential candidacy on a universal income for all Americans. And it certainly caught some interest, but Yang did not as a candidate. He dropped out. But it was, upwards of around $1,000 a month for every American, and that was quickly kind of regarded as a policy no-go zone. And then today, Mitt Romney, the former Republican presidential standard bearer, in 2012, he lost to Barack Obama, but former governor of Massachusetts, now a Utah senator and a Republican. He is advocating $1,000 a month go to every American. Would you have thought at the beginning of this year, David, that you would see Andrew Yang and Mitt Romney on the same page about giving $1,000 a month to people?
Yeah, but in fairness, I mean, Andrew Yang was talking about a permanent $1,000. I think there would be a permanent new benefit everybody would get. I think what Ron was talking about is only during this coronavirus crisis would they get that. It's a much more short term way to infuse some money in. But to your point, yes, it's definitely the same idea that seems to have crossed party lines.
Tom Cotton has also come out today suggesting legislation to get cash stipends to affected workers and their families to pay bills during the crisis. And Tom Cotton and Mitt Romney, both have railed against government handouts throughout their careers. And this is obviously a completely new circumstance, but a lot of people are reacting with surprise to these Republicans coming out publicly for cash to be handed out to the American public.
Mary Ellen, we've got another coronavirus briefing from the White House that's scheduled to start at 3:30. Luckily, it is not in the middle of this webinar, as a lot of the news is. But what are you looking for in that? Are we going to see some more restrictions or a little bit more adamancy about respecting social distance, or are we seeing something potentially more draconian, like shutting down airports or some of the stuff that's been rumored?
Yeah, so I do think that we will, first get a follow-up on the CDC restrictions, recommending that gatherings of more than 50 people do not move forward in the next 2 months. That was something that many of the officials who I expect will be at the White House briefing today previewed in their briefing last night, and then the restrictions came out an hour and a half after that wrapped up. So I expect that you will be hearing a lot more from government officials urging social distancing, especially we've had so many state officials, as I mentioned earlier, coming out and shutting down restaurants, gyms, bars in their states. That this is something that I expect you'll see more and more people urging. I also expect that you might start to hear a bit more about hospital preparedness, which is something that, now that the administration says that they're going to be getting a lot more tests out into the public and more labs opening in the next week, I really expect that looking at the healthcare system and how providers and hospitals and other facilities are prepared to handle the influx of patients that they might be seeing in the next couple of weeks to be a big issue. The president spoke with governors earlier today, so we might hear some more about that discussion as well and sort of what his message to governors was.
And David, real quickly, Larry Kudlow, one of the things that he mentioned, this is the president's chief domestic policy or fiscal policy advisor. He was talking to reporters earlier today, and some of the things that he mentioned, the plans that are already outlined by the president, such as funds available through the Stafford Act, deferral of income tax payments, deferral of student loan interest, and purchase of oil. Like a lot of that, what he was referring to in shorthand was what's in this House bill, the things that are all wrapped up into the House bill, correct?
Jason, it's hard to tell. It's changing so quickly, and there's so many ideas, I think, being put on the table. He might be talking about, a bigger size to all of these things that are currently in the bill too. We just don't know. There are no specifics yet on what this new package could be, so it's hard to know. I don't think they've sorted it out themselves yet as to what they really want to push for in this next round.
And one thing that is another question that's come up with the folks listening in the webinar. About nonprofits. I assume that this is not just for-profit companies. These are nonprofits that would be subject to paid leave or sick leave and so forth. Correct?
I believe so. I don't think the bill makes a distinction between for-profit and nonprofit, to my recollection. So I think that it would cover them too.
And that would be, anything from, I think the NCAA is technically a nonprofit organization, as is the kind of local community health and environmental groups.
Right, and they would get these employer tax credits, which covers the cost of the workers' Social Security payroll tax, as I understand it. But of course, some business groups are claiming that just isn't good enough, and they would still have a cash flow problem in terms of making this work.
Catherine, let's just recap on the schedule for us. I mean, again, we keep on referring to the recess and the canceled recess. I mean, the House is on recess, but it was scheduled to do a pro forma session at 11 a.m. You know, this is because they usually don't pass the sort of these resolutions that allow them to not meet for 3 days apart at a time, which is part of their protocol for the chambers. So the House is technically here, although they're not really here, and we're still just waiting, right? In on the House side.
They're here enough. They're basically on standby. So they gavelled in this morning, and then almost immediately went out, subject to the call of the chair. So right now, lawmakers and reporters are waiting to, one, see text of these technical correction changes to that legislation, and two, for action to be taken on it. We do have lawmakers who are in the building saying that they will not vote for it unless they see the text and approve of it, which was an issue on Friday night, that the text came out less than 20 minutes before the House had to vote on it. So there's pushback against that. As for the rest of the schedule, once that occurs, what if the House is able to pass that legislation by unanimous consent, the Senate is the next step. It is not the first item on the Senate's agenda. The Senate already has been scheduled to vote tonight on some intelligence legislation on surveillance authorities, but this would be next on the Senate's plate if it moves forward and if Mitch McConnell takes action to move it to the floor.
Yeah,
Jason, if I could just make one amendment to what I said earlier, because in reviewing this new some of the new language that's floating around, I had said that there's a possibility that with this technical correction they're taking up, that large companies might now be subject to the paid leave requirement. It looks like now that's not the case, that they probably still would be exempt from the paid leave requirement. So I just want to point that out. But of course, we should say everything is still very much in flux here, and who knows when it gets to the Senate whether they may be amending this again on paid leave, because it's very controversial. So the bottom line is we really don't know the status here of how this paid leave is going to be worked out one way or the other.
I will note that what we were thinking was a best case scenario in terms of like whether something would be passed today in the House was, they would gavel in the House in the pro forma session. They would ask that the technical corrections be passed by unanimous consent. And when we saw one of our reporters was in the chamber and saw a couple of members, Louis Gohmert, a Republican from Texas, was among them, gathering, we knew that this was not going to be something that was going to move quickly, and that is certainly the case, because we are several hours into this. Usually, these pro forma sessions are over in a matter of, sometimes a minute. There's a prayer, there's a pledge of allegiance, and then they maybe read something into the record, and it's they're out of there. But and they usually ask somebody local. I think it was Jamie Raskin, a Democrat from Maryland, who was tasked with being the presiding officer today. They usually ask somebody who's fairly close by to do these. But this is among the longer subject to the call of the chair sessions, if you will, for lack of a really inartful way of stating it. But that seems to be
Stand by.
Yes, a stand by. So over in the Senate now, 3:00 is usually the hour that on Monday they open the chamber for business. We sometimes will get leadership comments from Mitch McConnell, the majority leader, and Chuck Schumer, the minority leader. Some other folks can come in and say, like what's up, what's on their mind after the leaders make their comments. But then the 5:30 vote, and that's the case today, is, sort of what we colloquially call the bed check vote. That's when they really have to be there. That's when folks are supposed to register that they're here. It's the attendance vote. And we still don't know how many people are going to be here for that. I mean, of course, we've got the members under self-quarantine. Some other folks may have, have other reasons for being late. I was trying to do the math on how long it takes to drive from Cleveland. I'm sure Senator Brown, probably budgeted enough time, but you never know. What, Catherine, as you sort of migrate, back and forth between House and Senate, is there much activity aside from the occasional lonely-looking staffer?
Well, it is pretty quiet up here. I think a lot of staff have taken the direction of the CDC and frankly their bosses to work remotely if possible. That being said, with the CDC guidance on not gathering more than 50 people together, votes tonight will, although they have an exception because it is a government activity. If it was not, it would definitely be in violation. We're going to have more than 50 members is my guess, and also any staff, the clerks and all those other support staff that need to be on hand when legislative action is underway, they'll be all together. I will say that with the guidance that reporters received about social distancing, that is also something I'm on the lookout for today. There is an awareness that these senators are vulnerable and that maybe being surrounded by a lot of reporters asking them questions in a confined space may not be good for the health of any of us. But so we're hoping to see some cooperation among the press corps today to keep everyone safe, but also keep our government accountable by asking important questions about what's ahead.
Mary Ellen, I was wondering, as somebody on the front lines of reporting the healthcare policy on this, have you also become basically your friends and family's go-to person for information on this? I mean, that could quickly get exhausting, I would guess.
I have actually, yeah, and that actually, started a few weeks ago. You guys, everyone listening, may recall that Dr. Nancy Messonnier, she's a CDC health official. She said, probably 3 weeks ago, prepare for severe disruption to our lives. And, most people, myself included, didn't really know or have any expectation what that would look like. But, I started tweeting about that, and I started getting texts and calls from friends and family asking, how do I know if I get the virus? I feel perfectly fine, but what are the symptoms? Like, I'm hearing about this, but I don't know much about it. I will say that I have been in my apartment for most of the last few days, and I've taken the time to catch up with a lot of friends and family members that I usually don't spend quite as much time on the phone with. So definitely trying to be as helpful as possible. I've been spending a lot of time listening to the public health officials in the last few weeks. So yes, definitely a resource for friends and family, and trying to be helpful to anyone who I can be helpful to.
I just wanted to note too that for the folks participating in the webinar, that this is not your only chance to hear our voices. We are also participating in the CQ on Congress special coronavirus report podcasts. We broke that out on Friday, and folks have, in a really busy and challenging time, we feel it's important to reach out in as many different mediums as we can, whether it's through our writing, online. We will have print editions of Roll Call this week on Wednesday. We'll have a CQ magazine later on. But we're also participating in the CQ on Congress coronavirus special reports, which come out. There's a 1 minute sort of rundown of what to expect for the day. That's we try to publish at 6 a.m. On that platform, and then a longer download of what happened during the day at 6 p.m. With a 5:30 vote today, we may push that 6 p.m. deadline a little bit for that podcast. And then I also host the Political Theater podcast, which comes out on Wednesday, and that will have some definite things to say for that. Um, there's also, I mean, I just, before we all start to wrap up, I just wanted to mention that the customer support for FiscalNote and CQ are there, the normal people who you would interact with for user experience, or the folks that handle your subscription, or the people you talk to on ads, what have you. They're all available. We're all working. We're not not all of us are at 1201 Pennsylvania Avenue, or in New York, or up on Capitol Hill. Some of us are, as Mary Ellen said, working in our. I'm not going to say we're working in our pajamas. I have definitely a professional wardrobe on right now, but those some of those early morning things possibly. So I think we've got time for a couple more questions if folks have the need, but I also want to respect everybody's time and get to make sure that you have time to sort of plan the rest of your day and week. I hope that this has been a helpful exercise. We certainly it helps us, just if nothing else, exercise our own thoughts and make sure that we're kind of stating things plainly. Um, here's another question, actually. How are members of Congress reacting to the executive order to prioritize buying American medical equipment? I'll throw that if we.
I can say that that was something that was being discussed, supply chains last week when I talked to a couple lawmakers. I will say that I'm not a medical professional and I'm not usually a healthcare reporter. I let Mary Ellen handle that. But members were concerned about the supply chain that of the major mask producers in this country moved their production overseas a few years ago, and that has meant that we're not producing as many masks here in the US. So when there is a crisis, you have to worry about that international supply chain. And I know that, uh, like after the hurricanes that hit Puerto Rico, things we saw some supply chain issues with saline solutions and other vital medical supplies because so much of that was produced there. We are seeing that again now, and lawmakers, it is definitely on their radar. I cannot speak to anything specifically in the package that addresses that, but I will say that lawmakers on both sides of the aisle are talking about it and are thinking about it as hospitals in their communities uh, are finding that supplies are running low.
And I know Larry Kudlow, the Trump's top economic advisor, was talking to reporters today and floated some idea of offering some kind of tax cut for companies that relocate their supply chains to the U.S. What exactly he has in mind, I don't know, but that's at least being talked about at the White House.
I would only add and echo Catherine that this is a concern of lawmakers. Was talking with Marco Rubio last week. He raised that this has been a concern of his, supply chain issues, for a year or so now. So it's definitely something that's on lawmakers' minds, and I would not be surprised at all if you saw it in a future package. One of the things that several senators coming out of a briefing said last week is that part of this concern that as testing kits become more available across the country, that healthcare providers won't have enough swabs or other healthcare materials to administer these tests. So I would not be surprised at all if this becomes a focus of a future legislative package. Of course, it's difficult to really quickly address these issues that are supply chain issues, particularly if manufacturers are abroad and not currently in the U.S. So yes, it's definitely something that lawmakers are looking at, and I would expect we'll be addressing more in the future.
Mary Ellen, one question. It looks like we're starting to see a little chatter of border closures, possibly with Canada. It's in kind of an unconfirmed report right now. Are we likely to see a lockdown soon? I mean, or do you think that it would be more of like a regional aspect? I mean, like certainly like the more populated parts of the country are at greater risk, and would it be this rolling sense, or are you getting any kind of indication that they're talking about a broader domestic travel ban?
So you probably saw, over the weekend, there was a lot of airports were really overwhelmed as people, tried to get back from Europe this weekend before the foreign travel ban took effect. DHS Secretary Tom Wolf, said last night they were working on that, trying to get, make sure that it was down to about 30 minutes that people were waiting as they tried to go through customs and immigration and get their bags and all that. At this point, we haven't really heard anything specific about a broader domestic travel ban. There's been reports about grumblings, but, administration officials haven't really said that is coming yet. Of course, it is something that we've seen in a lot of foreign countries, but it seems to be something that administration officials are somewhat hesitant to do. And, you've also seen this on a state level. Washington Governor Jay Inslee has sort of said he was hesitant to do a total lockdown, and that's in the state that the virus is at its worst in the U.S. right now. So that seems to be a little bit further than people want to go at this point, but obviously we've seen more aggressive lockdowns in foreign countries. So who knows what could happen there.
And I think this will probably be the last question we have time to take. And I'll direct it at you, Catherine. And this is kind of tough because I think a week ago we didn't think that we would be at this stage. But for the next couple of months, as we realize that if we do have a 2-month long kind of social distancing and crackdown on large gatherings, what are the congressional offices doing? What are some of the concrete ways that they're preparing to have staffers work with constituents about issues that they have? I mean, some of these are already just sort of done with over the phone, but like these fly-ins that you talked about earlier, I mean, those are kind of off the table now. What's life going to look like possibly in the next couple of months if this continues?
I think that members who usually might hold teletown halls while they are up here in Washington will be moving those. We already know that many House members this coming week have those planned. That is when constituents can call in and ask questions like a traditional town hall, but all over the phone. I talked to Donna Shalala of Miami, Florida, Democrat, and she was saying last week that while she loves doing regular town halls, people who might not have time or can't get childcare or have issues like that, conflicts, she gets a much greater turnout for her teletown halls than a traditional town hall because you can, do it on your phone and maybe can be doing the dishes while you're listening to your elected member of Congress talk about the issues of the day and the issues in the district. So we're going to see a lot more of that. We're also going to see, like I said, a lot more of phone calls with constituents, phone calls with advocacy groups. I know that is a huge disappointment for some people out there, and it's a disappointment for lawmakers also. But I think lawmakers are stressing that it's their top priority is to keep everyone that they can healthy. And so that social distancing, it's also going to pose challenges for offices that are used to doing everything in person. And some people are working remotely for the first time from who are usually on Capitol Hill. They're just this week. They did not even have laptops before. They were working on desktops in the office, had to get those set up. So we're going to see changes. But I do think that lawmakers are so aware of the concerns that constituents have of being cut off from their lawmakers in this crisis, that they are tending to communicate more. And one of the reasons they like the teletown hall more than, say, doing something like this that is computer-based is that older constituents may not be as tech savvy, and that older constituents know how to pick up the phone and get on there. And so trying to reach people where they're at and where they're comfortable with. So we might see some Facebook Lives, but we're also going to see a lot of telephone-based communication.
We're going to have to end it there. Thank you so much, Catherine, David, Mary Ellen. Thank you very much for attending this webinar for FiscalNote CQ Roll Call. I hope it's been useful to you. We've certainly had a good time kind of trying to figure it out as well. And I hope that you'll continue to tune in as we do more of these. Thanks so much, everybody.